We are getting started just a smidge late. We had some technical challenges. That's okay. That's what keeps us on our toes, right?
Yes, yes.
But we'll give people just a few minutes to get logged in to join us, because I cannot wait for this conversation with one of my absolute favorite people in the entire world. So all right. As people are joining us, we're going to go ahead and get started. I am Dr. Gillian Goddard. I am an endocrinologist and the author of The Savvy Patient here on Substack. And I am so very excited to be chatting today with Marisa Renee Lee, the author of Holding Both, which I'm so excited to read, and Grief is Love. And and she also has a fantastic Substack. So thank you so much, Marisa, for being
Of
here
course.
today. Technical hoops and all.
I am happy to be here. And folks, just in the interest of full disclosure, in addition to being an endocrinologist, Dr. Goddard is my endocrinologist. I am very proud and grateful and lucky to report. She has been such a phenomenal support to me over the last, Dr. Goddard, it's been almost 2 years, which is sad in some ways.
It has been almost 2 years. That's crazy.
But I am deeply grateful.
Oh, it's truly my delight. I wish all my patients were as absolutely lovely and thoughtful as you are. So we'll stop this love fest though. Because there's a couple of things that I really wanted to talk with you about today, because I think you bring such a useful and thoughtful perspective to chronic health issues, sort of generally. And I know we talked about this. We're going to share. It's partly because you have experienced at least 2 separate chronic health issues that tend to actually interact with one another and
unfortunately
create some challenges that I think you have shown just so much grace in navigating. So
thank you.
Why don't you first share with everyone your first sort of long-term health problem, which you were diagnosed with several years ago, and that is premature ovarian insufficiency. So if you could share a little bit about how.
Yeah, it's funny. As soon as you were starting to ask the question, I had this memory of high school. I was either like 14 or 15 years old. So a few years into puberty and post my first period. And I passed out in class one day from just like
Scary.
period pain and bleeding. And, you know, back then, I feel like if you were a young woman who had hormonal challenges like those, they would just put you on some form of birth control. And, you know, maybe if you were lucky, you'd get a couple 100 milligrams of ibuprofen and sort of be sent on your way. And that was my story. And I know a lot of women have similar stories. And then it was in early 2011, probably right around this time of year. I had been living in DC for a little over 6 months. I was working in the Obama administration. It was like dream job, amazing friends, great community, like loving every minute of it. But in a span of about 18 months, I'd only had my period 3 times. My mom had passed away 2 years prior. And so, you know, we all sort of assumed it was a combination of stress and then, you know, this big move and big job and everything else. And so I personally was not worried about my health until I started having like really intense depression and anxiety symptoms. And I have a younger sister who lives with bipolar disorder. And I genuinely was thinking, could this be what's happening to me?
Right.
And I went to see a psychiatrist. And after a couple of sessions, he said, when is the last time you had a physical? When is the last time you had blood work? And, I was young and having a good time. And before that, my mom was sick and dying, and I was a
Yeah.
caretaker. And so, like,
Yeah.
I hadn't been in a while, and I went and got checked out. And I remember the OBGYN calling me back and saying, like, I want you to come in, I want to talk to you. And
Mhm.
I can still, Dr. Goddard, like, I can put myself back in that office so easily. I know exactly what I was wearing. I can see
Yeah.
his face. I can see like the Obama poster hanging next to his desk, and he's talking about all of these things. And he's
Mhm.
like, FSH and estrogen and LH. And I was like, you're
Yeah.
speaking Chinese. Like, what?
Yeah.
Like, I said to him, just because of my own experiences with my mother's health, I was like, am I going to be okay? Like, am I going to die?
Yeah.
Do you think I have cancer? Like, what is going on? And he said, no, I think you are essentially in menopause. And I had just turned 28. So I was
Oh
just
my
like,
gosh.
I was like, "What?" Like, I was so confused, and at the
Yeah.
time, they called it premature ovarian failure, and that was
Yes.
what
Such a
he
lovely
Yeah,
term.
yeah, yeah. Oh, yeah, and that was what he suspected, and
Yeah.
another round of blood work and ultrasounds and all the things confirmed that yes, I may have been 28, but my ovaries resembled those of a, like, 75-year-old woman. At that point, there were no options around harvesting eggs or, any of those
Right.
types of interventions, like, ship
Yeah.
had sailed, and with
Yeah.
the ship, Marissa's fertility.
Yeah. No, that's such a lot. And I think there's a couple really important points that I want to like hammer home. One is you're right. Unfortunately, it is true that young women and girls, even sometimes today, although I would like to think this is changing, that sort of this idea of like pain and like suffering with your period is completely normalized
Yep,
as though that's just something you have to put up with.
yeah,
And I think we really have to get away from normalizing that
I
because
agree.
it's just so unfair and can make women minimize their own symptoms that they're
Oh, 100%.
experiencing, right?
If you
And
think that you should just be in pain once a month, then when you're in pain once a month, you're fine with it.
right, right, exactly. And I think that I mean, it's really quite a dangerous social construct that we have that's this idea that that's just something that women
Yeah,
and girls need to tolerate. And I think the
crazy.
other thing is this idea um that, you know, mood is so closely tied to our hormones and that's something we don't talk about a lot, but some of your early symptoms were really mood related
Oh, yeah,
symptoms.
yeah,
And I think it's really important to highlight that because,
it's
I think
huge.
again, a lot of times we are like, oh, well, you're just depressed or you're just
Yeah,
anxious. And of course, nobody's just depressed or just anxious. Those are like real clinical diagnoses, but also
yes.
they can be a sign of so many other things.
Exactly. I tell that to people all the time, especially I'll be 43 next week. And so
Happy
at
birthday.
this age, thank you, thank you. Obviously, you know way more about this than I do, but at this age, like a lot of women experience hormonal changes that
Mhm.
can result in feelings of anxiety and depression. And so
Absolutely.
many people will come to me and say, I went to the doctor, I'm now on whatever medication, it's helping, but, like, I still just feel kind of off, and I'm always like, did they do, like, a complete lab workup on
Yeah.
you? Like, did they check your hormones? And most of the time, the answer is no, and
Well,
that is so distressing to me.
there is this idea that you don't, even the guidelines say that you don't have to check reproductive hormones. You can just treat people. But my concern there is not just, I mean, not in your case where someone's 28,
Yeah.
your hormones should 100% be
Yeah.
checked. That's a different story. But it's also just this idea that, you know, if you're in your 40s, everything is menopause. And so we should just treat you for menopause. And we
Yes,
shouldn't
yes, 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 yes,
even
yes.
look, people don't even think about the fact that they have all these other hormones
Yeah,
that their reproductive hormones may be interacting with, the symptoms can be sort of similar. And so I think we have to be really careful about,
yes.
it's just perimenopause and pop you
Yeah,
on treatment. Um, I mean, for you, we found that finding just the right balance of
yes.
estrogen and progesterone and even testosterone is really important to help, in helping you feel your
Yeah,
best.
yeah.
Um,
And, oh, sorry, I didn't mean to cut you off.
no, go ahead.
Well, the other thing that I will just also say to women is, when it comes to hormone replacement therapy, if the first thing doesn't work, I just wanna encourage people to not give up. Like, I have been on so many things,
Everything.
all of the patches, all of the pills, the gels, the creams, the rings, like, I have done so many things that the other day I went to pick up a prescription at Walgreens, and she was like, "Oh, we don't carry this anymore." And I was like, "I just got it a month ago." And she's like, "Oh my god, I was looking at one of your old forms of estrogen." I was like, "Yeah, we moved past that." Like,
You're like, that
so
was
yeah, so
like
please
3
don't give
years
up.
ago. Well, and also this idea, and I think you have really found this, is that at certain times, certain formulations have worked really well for you, and then they've actually stopped working.
That
Um, and that's been a lot of our work together, has
yeah,
been kind of trying to, deal with some of those challenges around, this was working for me. I was feeling really good, and now
yeah.
I'm not.
Yeah,
Um,
yeah, and that's scary. Like, as
yeah,
someone with multiple health issues, you just wanna keep getting better,
yeah,
All you want is to, like, be some version of okay, and to have things just all of a sudden not work for you anymore, like, that yeah, I would say that's probably been one of the most frustrating things. That and the other thing that I'll say on, hormones, and again, you know this better than I do, like, some things, like certain types and brands and formulations and whatnot, like, they can be difficult to get your hands on. And that in and of itself becomes another form of work that you have to do.
oh, 100%. One of the things that happens with hormones that I think people don't always understand, when we talk about medications generally, we typically use brand names and generics very interchangeably. And for
Mhm.
like 90% of medications out
That's
there,
fine.
that's great. That's
Yeah.
totally fine. Hormones tend to be require a lot more nuance. And this isn't just reproductive hormones, but like thyroid hormone. And
Mhm.
in particular, getting the right formulation can make a big difference. And if the insurance or the pharmacy switches
Oh,
you
yeah.
from the brand to the generic or from one generic to another generic, they don't even have to tell you. And that can actually
Yep.
have a huge impact on how your body absorbs the hormone, processes the
Yep.
hormone. And so you have to be, unfortunately, you really have to be your own advocate because
Yeah.
nobody, like I would, as much as I would love to go to the Walgreens with you, Marissa, I'm sure it would be very fun. Um, I think that you probably don't want me to have to come with you to Walgreens all the time.
I mean, that
And-
would be great, but
but like we can't, doctors can't do that. Pharmacists are in many cases overworked
oh my
and
gosh,
they're not paying
overwhelmed. Yeah.
attention. They're totally overwhelmed and they don't always have the education,
Yeah.
the same level of education about some of these things. It's variable. So
Totally.
you really do have to learn to advocate for yourself, even at the pharmacy.
Oh, yeah, those people are my friends now. I'm not you think I like
Yep,
Tracy at Walgreens, like,
yep,
she saved me multiple times last week. Like,
yep, yep,
that's
yep.
how I roll because you really do have to treat long-term health challenges like a job.
Yeah, yeah. And so you and I met 2 years ago and we had this lovely visit, and you were like, we were all excited to start making some changes and help you
We
get
had
feeling
plans.
better. And literally, like what, like the next week?
Oh my god, yeah, I wanna
It was
say it was
literally the
between
week after we met.
Yeah, it was between 7 and 10 days later because
Yeah.
we had a protocol in place. I was starting on a new medication with
Yep.
your assistance, and then I got COVID for the first time.
Yeah.
And I had been out in the world. I was on book tour in 2022. I traveled, like, I did all the things,
Yeah.
but,
You
somehow
had a toddler,
yeah,
like, in
like, who was going
in,
to
like,
school every day.
going to school, like, you were exposed to all
And
the
during the
germs.
pandemic, my husband was, like, on the front lines and then coming home
Yeah.
every day, like, somehow it didn't get me until April of 2024,
Mhm.
and it took me down hard.
Yeah.
I was diagnosed with long COVID a couple of months later,
Mhm.
and one of the things that I have learned through the process of just having been sick these last couple of years is the very real interplay between illnesses and symptoms and the way things show up because
Mhm.
so many of my worst long COVID symptoms, which a headache where my head feels like it's stuck in a vice and the pain is so bad that I woke up one morning and realized I bit off a piece of my mouth guard in my sleep, like completely unknowing. We think I swallowed it, don't really know. Um,
Oh, no.
it's the same as, like, my worst hormone-related symptom.
Mhm. Mhm.
And, because COVID and long COVID are still so new, we know that there is interaction there, but, like, what exactly that looks like, how it
Mhm.
changes, how to manipulate it so you can get back to baseline as quickly as possible, like, all of those things,
Yeah.
we don't know. Like,
Yeah.
we just don't know. And then the other thing I'll say that, like, is deeply frustrating to me, and I know you feel this too, we don't know as much as we should about women's bodies and the hormones that impact women,
Mhm.
partially because we don't study women and women's health conditions enough. Women were not even required to be included in federally funded research studies until like 1993.
Yep,
Like,
that's right.
it's like, and that kind of stuff, I mean, it just
Yeah.
like my palms start to sweat. Like, I just get so enraged.
Oh, you and me both. And you're
Oh,
right, there is some really complex interplay between COVID, long COVID, and hormones that we don't have a good understanding of. Um, and and it is different for women than it is for men, in part
yeah.
because women's immune systems are different from men's immune systems. We're more likely to develop problems where our immune system is sort of goes awry and
Oh, I
is
didn't know that.
attacking our bodies. And so we're more likely to get autoimmune disorders, and COVID really does all kinds of crazy
Yeah.
things to people's immune systems. I'm not an infectious disease doctor, but I know that in the last almost 6 years now, I have seen more women with autoimmune hormone
Yeah.
problems than ever before because of COVID, and we don't
Yeah.
understand it well. But what we absolutely know is that, over the course of your illness, and I've seen this with other patients, you're the other thing that's going on is the long COVID itself and sort of the immune system and the inflammation has also changed your hormone levels,
Which is
um,
so crazy.
in really kind of in ways that you can feel. We can see it in blood work, but you can also feel it.
Yeah.
Um, and in fact, I've learned that when patients come in saying, "I think this is how I felt when XYZ was going on
Yeah.
before," patients are really good at kind of, especially patients who are tuned into their bodies and who are used to kind of thinking and being sort of analytical about how they're feeling,
Yeah.
are really good at identifying those changes, and so I tend to listen because
It's
I've
true.
noticed that patients are often right about these things, and it never hurts to check, right?
And that's another excellent point. Like, I think oftentimes, women in particular, but men too sometimes, we feel like because we're the patient as opposed to the expert, that we should just, listen and follow instructions and not ask questions or share information or, frankly, like
Mhm.
collect our own data. And
Mhm.
I think it's really important to kind of to do your best. And this is where when I'm not writing, I am a strategist for
Yeah,
organizations and nonprofits and political
yeah,
institutions. And like this is where my strategist hat comes in. Like
yeah.
I want people to think about their health and the symptoms that they experience and what is happening to them as another piece of data. Like my
100%.
education is like this much, yours is like, infinity much is what my 4-year-olds would say. But like at the end of the day, like I've lived in this body for almost 43 years and I
Yep.
know when things are right and I know when things are not quite right, even if
Mhm.
it's just like around the margins.
Yeah.
And thankfully, you are the kind of physician that brings curiosity and humility to the conversation. You're not just like, "Oh, no, Marissa, like you're going to be fine. Like you're fine. I've got this." Like, no, it's not that. And when doctors talk to you like that, like I want to encourage people to find different doctors.
Yeah, I mean, I actually, when I think about how you should prepare for a visit with your doctor, I actually think you should do two things that people always think are wrong. One of them is what you just said, collect data on yourself because those data points are so incredibly helpful. And that's sort of helps us too to know when something is working. Like if you
Yep.
know what's wrong, then you can also measure how things might be improving or
Yep.
not with treatment. But the other thing I encourage people to do is to do their own research. And people are always
Yes.
shocked to hear that. And I don't mean go in Dr. Google and find
Yeah.
out what
Don't
to
do that.
ask for,
Yeah.
like what
Yeah.
medicine to ask for. That's not the kind of research
Or
I'm
the
talking
Dr.
about.
Google rabbit hole where every answer is like, it's a
You're
tumor,
going
you
to
have
die.
cancer, you're going to die.
Yeah. Yeah,
Don't
exactly.
do that,
Exactly.
please.
Don't do that. But I think doing a little bit of more targeted research can actually be super helpful in framing your questions for your doctor and the kinds of data that you might
Yeah.
collect on yourself. And so I would
100%.
say, go to some of these websites that are like disease specific websites if you have a diagnosis, or,
Yeah.
go to the Mayo Clinic website where they
That's a good
have
one.
symptom. You can put in a
Yeah.
symptom and it'll pull up some ideas. So, you know, research fact, not
Yes.
Dr. Google, not going to tell you you have cancer and you're going to die.
Exactly.
And not with the idea that you're going to figure out on your own what's going on, but
No.
as a tool to help you frame your questions and to know kind of what symptoms to be collecting data on, how to think about these things for yourself.
Exactly. Like there are two things, just two examples real quick.
Yeah.
So for context, obviously, I've been dealing with the headaches as a part of this round of hormone adjustments and long
Yep.
COVID, but I had a period of 2 years where I had hormone related headaches after pregnancy loss. We did
Mm.
egg donor IVF, didn't work out. Um, 2 years of just like pain and misery. And I then started reading like medical journal papers and like NIH research studies and summaries and things like that. Cause like I'm a dork. Like I am a dork. I'm comfortable with that.
Of the best
Um,
kind.
I just it is what it is. And so between the symptom tracking that I did back then and the research, I got to a place of, oh, I wonder if we should try this other form of progesterone. And I
Mhm.
took it to my endocrinologist at the time, and she was like, "It can't hurt." And 48 hours later, headaches were gone.
Amazing.
That same research then, years later informed some of our conversations because I
Yep.
was able to go back and say, well, this is the headache presentation that I described during
Yep.
that period. And that's why I think maybe there's still something hormonal that we need to
Yep.
adjust a little bit. And you were like, okay, yeah, that makes sense. Let's try this and that. And like,
Yeah.
you really you want to find physicians who are going to partner with you to just be creative and find
Yep.
whatever unique solutions your body needs.
And I think that's especially, I mean, it's a message that everyone can benefit from, but I think it's especially important when you're trying to manage chronic illness.
Yeah, Lord Jesus.
But nobody makes lemonade out of lemons the way you do. So you have
Try.
written you have a new book coming out very soon,
Yes.
um,
Yes.
that is all about navigating chronic illness. So why don't you tell us a little bit about your new book? I cannot wait.
Yeah. So, it's so funny. Every conversation I have, people are like, "Your book is coming out soon," and as soon as they say it, like, I can, like, feel the anxiety flutters a little bit because 'cause I'm like, "You know what it's like." I'm like, "Oh my god, I have to sell 1,000,000 copies in the next 5 minutes." The book is called Waiting for Dawn: Living with Uncertainty. It is based on a couple of periods of uncertainty that I have lived through. Unfortunately, this most recent one being long COVID. And in it, my goal is to provide people with research backed tools and practices and ways to think about managing uncertainty when it enters your life. And I've been thinking about uncertainty as like any persistent state of stress or overwhelm
Mhm.
with no clear ending. And so it can be, a sudden and devastating chronic illness or disabling condition.
Yeah.
It can be a job loss or a pending job loss, a marital challenge or divorce, caregiving for an elder parent or
Mhm.
relative. It's these things that happen to us that in most cases we don't choose, or even if we did choose them, like in the case of a divorce, say, they're
Yeah.
still not ideal. It's not a choice that you wanted to make.
Right.
And I felt like it was really important, especially given all of the turmoil and political and economic uncertainty and instability that we're living through right now, to take what I have experienced and apply research to it and give folks a bit of a compass for how to navigate when life is hard, because it happens to all of us.
Yeah. Yeah. Unfortunately, fortunately or unfortunately, but mostly unfortunately, we will all go through times of uncertainty.
Yeah.
Hopefully we can make the best of it. And I don't want to be Pollyanna-ish,
No, I know.
some things just suck. Like
Yeah. Yeah. Yeah.
but hopefully we can find a way to navigate through it that has us come out standing and maybe even a little stronger on the flip side. But
That is
like
the
I
goal.
said, I
It
I don't want to
sucks.
be
Like, I'm not.
Pollyanna-ish about these things because some things in life just suck.
No, I mean, this period has been awful, and,
Yeah.
the book started from a place of my editor asking me to sit down in summer of 2024 and just write out how I was feeling.
Yeah.
And all of a sudden, I had 10,000 words and realized
Yeah.
those words could be structured into chapters and themes and
Yeah.
supported with research.
Yeah.
And now it's available for pre order.
Yay. Yeah, so absolutely pre-order Marissa's book.
Yes,
Um,
please,
it
please.
is, yes, I authors say this all the time, but it's because it's true. Pre-orders are so important to how a book does once it's out in
100%.
the world. And so please pre-order Marissa's book. And I know it's just such a great uh, I always enjoy reading your words. I always feel challenged and a little better about the world, knowing
Oh,
that
good.
there's somebody out there thinking about things that are often really hard, in a way that is
Yeah.
feels feels like we still have some agency and can have an impact. So
Yes, that is the goal. Thank you. Thank you, thank you, thank you, and thank you for all the work that you've done to get me to a place where I'm not in as much pain and could actually finish a book.
it's been truly my pleasure. Truly my pleasure. Well, thank you so much for chatting with me today, Marissa. I've really been
Absolutely.
looking forward to this. There's not
Same.
many people in this world I like chatting with as much as you. So,
Thank you, thank you, thank you. This was great. And yeah, I really just want to encourage people to, to use your word, Dr. Goddard, like just exercise agency when it comes to your health and your healing and just making sure that you have access to the things you need to be okay in this world.
yes, absolutely. Thank you so much. And thank you to everyone who's joined us and everybody who's watching this later. I am scheduling my next AMA. It'll be in 2 weeks and it'll be a Ask Me Anything. So please send me your questions. You can follow Marissa at Holding Both on Substack, and at Marissa Renee Lee on
Everywhere else.
Instagram.
Yes.
And you can follow me at The Savvy Patient, both here on Substack and on Instagram. And we'll see you all soon.
Thank you. Thank you.
Thanks, Marissa.
Bye.
Bye.